Hello, good evening. Dr. Trudy Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to today's clinic. Today we're going to talk about the 5 modern methods of contraception. So we're going to talk about the 5 contraceptives you can actually use in the modern way to prevent pregnancy. Now, I know predominantly the topics we discuss in our group, it's about having babies. It's about becoming pregnant. But it's also important to understand that contraception, it's important in the overall scheme of starting the family. The reason is because there are so many unplanned pregnancies out there. There are so many young girls, there are so many young women, there are so many people that started their family when they are not ready because of societal pressure. There are so many young girls that sought illegal abortion. There are so many young girls that might not be ready, their body might not be ready to carry babies, and they become pregnant. And in cause of becoming pregnant against their will, they might have complications, they can have damages to their body, they can actually die. So we are going to be careful. We have to balance our discussion in our group. Contraception, it's your fundamental right as a woman. You have to decide when you want to have a baby. You have to plan when to have a baby. You have to know the number of babies you can have. This is your right. This is part of what makes you unique. So we need to understand that life is not all about wanting to have babies when you can't take care of the babies, or once you marry, you begin to have babies that you can't take care of. So this is the premise for discussing the 5 basic modern contraception. Very important. So I want everybody to pay attention. And I'm making a case for contraception because we are living in a world of multiplicity. There are so many things you hear every day. There are so many relationships you go into with different mindset. But you have to understand that as a woman, you actually matter. This reproductive system is in your body. This is not in a man's body. This is your body. So if it's in your body, you have to decide. You have to plan. You have to desire. If you plan a baby, if you have a pregnancy, then you will be at peace. Now, the fact you want to start your family or you don't want to start your family yet should not come between your intimacy. So I still want you to engage in your relationships. I still want you to engage in lovemaking. Lovemaking is not just for making babies. Lovemaking is also for pleasure. So I still want you to do that. But remember the consequences of pregnancy. Pregnancy can change a whole lot of things, especially for young upcoming girls. There are so many of them that will just go to experiment for the first time. They might actually not have penetrative sex. They might be virgins and they can get pregnant. So it's important we inculcate sexual education, especially preventive measures. Virtually everything we teach in this group is to prevent things from happening. So if you are not ready to start your family as a young woman in her reproductive phase of life, your reproductive phase of life actually starts from around age 15, then it tapers off around age 49. So any woman from age 15 to age 49 can spontaneously, naturally become pregnant. So we need to look at the effectiveness of the 5 modern ways of preventing pregnancy. We need to look at the ones we can preach. We need to look at the ones that are long lasting. We need to look for the ones that are permanent. So depending on where you find yourself, there are so many families that have completed their families. There are so many families that wanted to have 3 kids. Suddenly you're having 6, maybe because of your religion. There are some families that, once the pregnancy go, they say, God brought the babies. That's not true. You have to know where you stand in the current trend of things. You have to exactly desire the number of babies you can take care of. Gone are the days you will have babies and the society will look after your babies, or you begin to blame people. Plan ahead. When you plan your pregnancy, you will desire the pregnancy. When you don't plan the pregnancy, there are a couple of complications that can come in. So when you are choosing your method of contraception, I want you to think about 2 things. Is it a reversible form of contraception? Is it a contraception that involves barrier? Is it a long-acting contraception? I would prefer to go for long-acting. I would prefer to go for methods you don't have to remember, so that when you don't remember, then it will fail. So when you are looking for reliable, effective method of contraception, think about reversibility. Can it be reversed? There are some forms of contraception that once you do them, is permanent. So you have to consider all these things before you make up your mind. Historically, generally, the commonest form of contraception is oral contraceptives. So you take pills on a sequential level, and it will go to your body, and it begins to change the whole reproductive system of the woman, the whole cycle of the woman, so that the eggs might be prevented from being released, so that the sperm might be suspended from getting into the womb to begin to go to the tubes. So there are different methods that contraceptive pills can effect stopping pregnancy from happening. Most contraceptive pills will contain the artificial form of estrogen and progesterone. So depending on the combination, they can prevent pregnancy from happening. So what have you noticed? The same drug we will give you to achieve pregnancy, we can also give you to prevent pregnancy. So it's important to understand the risk factors. Now, when you're taking oral contraceptive pills, which is actually a modern form of contraception, you have to remember to take them effectively. Now, there are some lifestyle you have to avoid if you are on oral contraceptive pills. Smoking, drinking, allowing yourself to accumulate a lot of body weight can predispose you to developing risk factors. So if you also have cancer history in your family and you're taking any artificial hormones, you need to be careful because it can predispose you to developing cancer. Now, among all forms of contraception, there is one that will achieve contraception, then also additionally stop you from picking up sexually transmitted infection. Condoms. Male condoms and female condoms, if properly used, will work effectively to stop pregnancy and will also stop you from picking sexually transmitted infections. Now, is condom the best? Personally, I don't recommend that. Why? Because you need to remember to wear condom. When you don't remember to wear condom, it fails. When you are not wearing it properly, it fails. When in the heat of the moment, the condom, kind of breaks, that's a problem. So you need to go for the type of modern day contraceptive that will not give you the pressure of remembering. The same thing is applicable to taking your contraceptive pills. If you don't remember to take them, then you'll be kind of worried. Oh, am I going to get pregnant or am I not going to get pregnant? So condom is an example. Contraceptive pills, oral contraceptive pill is also an example. Now, I'm going to give you one statistics, which is from WHO. The number of women desiring the use of family planning methods. So depending on the area you're coming from, generally, when you're talking about contraception, is actually classified as family planning. The number of women who actually desire to use contraceptive, it's actually doubled since it used to be around 900 million in the 2000s. Now it's around 1.1 billion people. 1.1 billion women globally as of 2020 would desire to use contraceptive to stop them from becoming pregnant. There is nothing wrong in becoming pregnant, but you have to become pregnant when you are ready. So number one modern way of preventing pregnancy is what? Use of oral contraceptive pills. How will oral contraceptive pills work? When you are taking oral contraceptive pills, you can take the one that will contain only artificial progesterone, or you can take the one that contain combined progesterone and estrogen. And what would they do? They will prevent the release of your eggs. So women that use contraceptives are actually women that are fertile, but you don't want to become pregnant within a particular time. So when you're taking those drugs, it will suppress ovulation. Remember, the process of releasing the egg is simply what ovulation is all about. Now, some form of oral contraceptives will thicken the cervical mucus Remember, your cervical mucus is a nutrient medium that supports the sperm to come in. Now, when your cervical mucus thickens, the sperm can come in. So there are some oral contraceptive pills that will stop ovulation from happening. Then there are some that will go and thicken the cervical egg mucus so that the egg and the sperm can not meet. This is the mechanism of action of oral contraceptive pills. Now, some women can also go for what we call implants. Implant is also a long-acting modern form of stopping pregnancy. When you use implant, you don't need to remember. We'll just put it in the subcutaneous layer of your skin. You put it there. It will be releasing hormone in a liquid in little quantity so that it will prevent you from becoming pregnant. When you are using implant, you don't necessarily need to remember. Once it's there, it's there. It's going to work for the duration of period you're using it. So implant is a modern way of still enjoying your lovemaking, preventing pregnancy, being happy, and not being fearful if you remember to wear your condom, if you remember to take your pills. So implant thickens the cervical egg mucus because the content of the implant is also hormonally based. Once the cervical egg white mucus is taken, the sperm cannot come in. For the cervical egg white mucus to be helpful to the sperm, it has to relax. It has to be able to carry the sperm along. But once it becomes taken, the sperm can come in, the sperm can meet the eggs, and lo and behold, fertilization will not occur, pregnancy will not occur. The other type of reliable modern form of preventing pregnancy is what we call IUD, intrauterine device. Intrauterine means inside the womb contraceptive device. The full name is IUCD, intrauterine contraceptive device. There are so many types, but the commoner one out there is the copper. How can copper form of coil? We call it T-coil. So it places inside the womb, and you will have a coil that will, kind of be just opposing outside, the cervix. And when that happens, it will be there for some long time. Some women can have their own up to 12 weeks, 12 years. Some women can carry up to 5 years, and it will give you protection you need. You don't need to remember to use your IUD. You just put it there, then you continue making love. If you want to make love every day, you make love. Now, when you are using the copper damages the component of the sperm and prevents the sperm from meeting the eggs. Now, some form of IUD will also thicken the mucus. When it thickens the mucus, it's going to create a barrier. The sperm can come in, so the sperm can meet the egg. So this is another way of causing contraception. Now, the other method is what we call injectables. When you take injectables, it's also long-lasting to an extent. So you can take it for 3 months, you can take it for 6 months. Once we give you that injectable in your body, you can go about making love and you won't become pregnant. How does the injectable also work? It will also, in some situation, depending on the type you're using, prevent egg from meeting the sperm, or it will also thicken the cervical mucus. So pretty much, various forms of modern method of preventing pregnancy actually work the same way. They prevent egg from coming in, they prevent sperm from coming in, they create a barrier, and if the egg and the sperm can't come in, pregnancy will not happen. So remember, I've mentioned oral contraceptive, I've mentioned implants, I've mentioned IUD, and I'm now mentioning injectables. The last one is what we call contraceptive patches. So just like the name sounds, it's a patch. So there are so many people you see out there in the street, you will see certain things on their body, you think is a plaster. You think it's an adhesive tape. Some of them might be a form of modern device. Some of them might be a form of where people get their insulin if they are diabetic. And some of them can also be a contraceptive. So contraceptive patches also help in preventing the release of egg. So these are the modern day technology, modern way of preventing pregnancy. Now, there are other methods. When you begin to talk about sterilization, when we talk about sterilization, you need to be careful. Sterilization means we're going to stop the woman pretty much permanently. So when we're talking about sterilization in a woman, we are talking about bilateral tubal ligation. So what do I mean by bilateral tubal ligation? We're going to go to the two tubes. We're going to tie the two tubes. Once we tie the two tubes, the sperm can come in, the eggs can come in, fertilization won't occur. Then you've succeeded in stopping this woman permanently from becoming pregnant. Now, this woman can still become pregnant if she goes for IVF. But naturally, once we damage the function of the tubes, you can no longer become pregnant naturally. When you're going for this type of method, you would have completed your family. You would have agreed with your man that you no longer want to have kids. Maybe you want to adopt, but you do not want to go for bilateral tubal ligation. Maybe your first relationship went bad, and your second relationship, your man wants you to become pregnant. Then you begin to go back and forth for corrective surgery to do all that. Don't do that to yourself. Now, men can also go for sterilization. It's also called vasectomy. The equivalent of what we do for women, we do for men. We tie the tubes that will conduct the sperm, which will come out from the penis. Once we tie that tube, then you can no longer allow sperm, which, remember, the difference between the sperm and the semen, you can no longer allow sperm to permeate and come out to fertilize the woman. So sterilization is a permanent method. Be careful. The method you're gonna use will be method that both of you will agree and understand properly. Now, some people can also go for what we call diaphragm. Diaphragm is a form of barrier method. When you're using it, you're preventing that opportunity for the sperm and the egg to meet. Now, some people can also use spermicidal agents, foamy jelly contents, which will prevent the sperm from having access. Now, this is the area you need to be careful. Now, there are some lubricants that will ordinarily be spermicidal. So if you're looking to have a baby, which is the opposite of contraception, so the people on the other end wants to have babies, and these people, they don't want to have babies. So if you want to have a baby, if you are using any product which you want to use for lubricants to lubricate the body of the woman so that she won't have pain, so she will enjoy her love making, you have to be sure it's sperm friendly. There are so many lubricants out there that you're not supposed to use. Now, when every other thing fails, when you forgot your condom, when you forgot to take your oral contraceptive pills, and within 5 days of making love without protection, you can go for emergency contraception. This is the popular Postinor 2 that so many women go about abusing. Within 5 days, which is approximately 72 hours, if you have unprotected sex and you don't want to have a baby, you can take this emergency. That's why it's called emergency, or it's called morning after. So it's only a woman that intentionally wants to become pregnant that will become pregnant in 2022. I'm talking about empowered women. If you know what you want and you don't want to have a baby, you cannot have a baby. Very important. The only person that will give a pass for a baby to come in the family is the woman. So any woman that knows, there are some women that might not know this. Any woman that is well educated, well empowered, knows her stuff, if she doesn't want to become pregnant, she will not become pregnant. She only becomes pregnant because she allowed it to happen. Because at any point in time, your body is with you. Your vagina is with you. Your cervix is with you. Your womb is with you. Your man will not go with you anywhere. So if you don't want to, you will not. I'm not encouraging you to go solo, but I'm telling you, you have a role to play in what will happen to your body, in the number of babies you want to bring to this world, in the number of babies you can take care of. I don't want you to end up being a baby making factory. Okay, so that's my presentation this evening. I'm going to allow us quickly to ask our questions. Immediately after this clinic, I'm going to give exactly this same clinic in our Facebook page. So if you're in our Facebook, if you don't have access to our YouTube, don't worry. I'm going to give another 30 minutes presentation immediately after now. But please start asking your questions. Okay? Thank you, COO. I'm going to take care of questions now. Thank you, Tosin. Okay? There are many types of contraceptives. How does one decide which one to use? Now, there are actually about 13 different methods for women. Then we have about 3 methods for men. Now, how do you decide? There are so many criteria. Number one, you have to acquire good knowledge of each. There is no perfect contraception. They all have their pluses and minuses. They all have their different levels of reliability, effectiveness. So you need to study them. Now, when you're done studying them, I actually want you guys to study independently. So while you're studying the 13 methods, your partner is studying the 13 methods, you're studying the 3 methods for men, your partner is studying the 3 methods for men. Then at the end of the day, you compare notes. You come together, you discuss about it. Now you select the ones you guys feel you might love. There are some pros, there are some cons, there are some that might affect your pleasure. Like if you're wearing condom, there are some people that don't prefer condom. There are some people that react to condom. So whichever one both of you jointly agree on, then you present as a team. You go to your gynecologist, you discuss with your gynecologist. Then your gynecologist will also tell you about the risk, about the merit, about the demerits. Then you try it out. There are some couples that might try one, it won't work for them, they will switch to another one. So some couples can try injectables, implant, IUD, and if it doesn't work, they will keep flipping until they have the one that will work for them. There are some women that will react differently to different types of contraception. There are some women it will disrupt their cycle. There are some women it will reduce their bleeding. There are some women it will increase their bleeding. There are some women that will have different presentations. So it's solely dependent on your unique body mechanisms. Now, there are a couple of things you have to do by yourself. Definitely, you have to live healthy. Personally, I will tell you to not smoke. Personally, I will tell you, if possible, don't consume excessive alcohol. Why am I telling you this? Anytime you're taking artificial hormone into your body, you are predisposing yourself to development of a couple of things, including cancer. So you need to be in a good place. You need to have a very good, healthy body weight. You need to have a very good BMI so that eventually, when you guys end up wanting to have a baby, thankfully, when you are on contraception, and you still have age on your side, within that period you're on contraception, you're not going to have a baby. When you stop, there is a tiny window of infertility when that content is still in the body of a woman. Once that window passes, you can still regain your fertility. Fertility doesn't rebound immediately unless you use condom. When you use condom, when you're done with condom, you're done with condom. But if you're using IUD, implant, injectables, patches, they will still be in your body for some time. Some women, it might take them 1 month. Some women, it might take them 2 months for their fertility to rebound. So for you to make a proper choice, you have to consult with your partner. You have to go to your gynecologist. Then you have to try different things until you find the one that will work for you. So borderline, both of you must agree on the one that will work for you. You have to listen to each other. Yes, some forms of contraception can actually upset your metabolism. So one of the side effects of some form of contraception is weight gain. So there are some contraception that will lead to accumulation of fluid in your body, leading to temporal weight gain. What can you do? Definitely stay active, eat healthy, so you can counteract the effect of additional body weight you might suffer as an adverse effect or side effect of using a particular contraception. So yes, in some women, when they are using a particular one, they will notice they are adding a lot of body weight. Some women will also notice acne. Some women will notice a lot of changes in their body. Some women, it will even affect your mood. So whatever side effects, whatever adverse effect, if it's not desirable and if it's affecting your activities of daily living, you can run to your doctor, then we can switch you to a different one. Okay? How can a woman know the suitable? Okay, I've already answered that. Many contraceptive list blood clot as a risk factor. Does this risk factor outweigh the benefits? There are some women that might have risk factors of developing blood clot, and there are some form of contraceptives that will increase that risk factor. So what do? We have to know your individual profile. If we know that from your medical history, from your previous history, from your current problem, that you might likely be predisposed to blood clot or a couple of complications, then the type of contraceptive we'll give you will be the one that will have a lot of benefits. Like I said, they have their benefits, they have their risk factors, they have a couple of ups and downs. So we need to come in the middle. Let me give you an example. If you are obese and you have hypertension and you have cholesterol problems and you have diabetes, definitely when we are recommending any form of hormonal-based contraceptives to you, we need to be careful. Because the more we are introducing all these artificial hormones in your body, the more we are making it worse. So there are some women that might be predisposed to developing blood clot, which can be an acute emergency. If we find you to be in that category, we will try and avoid the method that will predispose you to having blood clot. Very good question. Is it true that contraceptive fails? Definitely. There is no contraception method out there that is 100%. But what we know with the modern ones, they can at least get to upper 90s. So if you are using your IUD properly, you can get effectiveness level of up to 99% reliability. But there are so many ones on the lower cadre that can also fail. So there is no contraception that has 100% effectiveness. I'm talking about the ones that are practicable. But there is only one method that is 100%: abstinence. So if you don't make love, you don't become pregnant. That's 100%. But we're not talking about that. I'm talking about things when you eventually engage and you're using it, it's not 100%. So we've seen women that became pregnant even when they're on IUD, which is one of the best forms, which is one of the popular method of contraception that so many women are using now. So it depends on a couple of things in your body. Sometimes the failure might be related to a couple of things that happen in your body. The failure might be related to a couple of other factors in your body. So please be mindful. You are unique. How you respond to a particular one will not be how another person will respond to that. I love those questions. Can one use hormonal contraceptives while breastfeeding? Now, this is a catch-21 kind of question. Everything is also going to be tailored to your individual medical history. The reason is because when you're breastfeeding, you are still struggling to balance your hormone and you're still trying to take care of your baby. So we might go in the middle, depending on the option that might work for you. If we are giving you any hormone-related contraceptive when you're breastfeeding your baby, we need to think about the benefits. The benefits must outweigh the merit. So yes, we need to put into cognizance the fact that breastfeeding is a big factor, because the fact remains, if you're a new mother, you might be waiting for your period to come and suddenly you can ovulate and you can become pregnant. So all new mothers, one of the things we will tell you before you go home is to discuss your best form of contraceptive. Now, what might be best for you might not be best for the other person. Now, don't make the mistake of thinking, oh, I'm a new mother, I'm going to make love, my period hasn't returned, and you won't become pregnant. Before you blink, as early as 2 months, you can become pregnant, even when you have a little baby. So the answer is yes. Okay, can a woman still get pregnant while on contraceptives? Yes. That's why we have those tiny percentage of failure. So yes, depending on a couple of factors in your body, some can fail. We have had some women that became pregnant even when they are on IUD, which is one of the best. So the answer is yes. It's not foolproof. Now, directly when we are placing you on contraceptives, we are mindful of your normal baseline hormonal level. So not all providers will check your normal estrogen, progesterone level. But here's the deal. When you are taking any of those contraceptives, you're actually disrupting, you're causing artificial hormone imbalance. That's what you're doing. When you're taking estrogen, when you're taking progesterone, when you're combining all this, you're telling your body, you know what? I no longer want the estrogen level to be this way. I no longer want the progesterone level to be this way. So what have you caused? Artificial hormone imbalance. When you cause those artificial hormone imbalance, infertility will come in. So when you are on contraceptive, you have to understand that you are creating artificial infertility. That's what happens. So the answer is yes. You have fibroid, you're taking contraceptives before the removal of the fibroid due September. Wish to know why you're placed on the pills. Very important question. You see, sometimes the medications you're supposed to avoid, we are using it to take care of you. Why are we doing this? Because we want to take control of your body. Now, there are some women we might have a need to place their body on no activity level. So there are a couple of medications, like there's a medication we call Zoladex. When we give you that medication, we are suspending your body completely. So we can go in to stop that particular fibroid from getting big. So we control it minimally, so we can go there and handle it. Now, once you're done with the fibroid, we can now release your body and your body can perform naturally. This is the reason why we're using this for management. So some people that might be having infertility can actually be told to use contraceptives. Sometimes when we're using those contraceptives, we are using it to stabilize your cycle. So if you notice, you might be complaining of infertility and you go to the hospital and your doctor will tell you, oh, take pills, take contraceptive pills. And you begin to wonder, is this doctor going crazy? I want to have a baby and you're telling me to take pills. Why are we telling you to take pills? Because we want to take over. We want to stabilize your cycle. So we want to achieve what we call breakthrough bleeding. So remember, the same drug we want to use to cure infertility, we can also use it to to create infertility artificially. So you need to be mindful. This is why you're not supposed to take any drug by yourself, because some women might be taking Clomid thinking they're helping themselves, but they are indirectly causing infertility to themselves. Okay, I love these questions. Very, very good questions this evening. Okay, how important is it to check your doctor? Check with your doctor. Very, very important. Now, some of these drugs can actually cause permanent damages, and they can have drug-drug interaction. Like I'm telling you about alcohol, like I'm telling you about smoking, there are some forms of contraceptives you will be taking, it will make it worse. So you must consult your doctor. It's not a decision you just stay back and you do by yourself. No. And you must also, keep your doctor in line, because you might have adverse effect, side effect. So when you notice that your bleeding is now very heavy, very painful, previously you didn't used to have this, what do? You ring your doctor. It's the duty of your doctor to evaluate and change and investigate and switch you to another one. So yes, you must obtain express permission, express prescription. Oral contraceptive pills, I understand in some places, like in developing countries, you can walk into the counter, you can buy anything you want to buy, you can buy your Postinor. But generally, it's supposed to be a prescription-only medication. It's a medication and drug that your doctor will definitely control. You don't just go and say, oh, give me this, give me that. When you're doing that, you're predisposing yourself to trouble. Okay? You had a second myomectomy just this November, and for the past 3 months, you've had irregular menses. What should you do? Go to your fertility specialist. The fact you've had a second myomectomy, in as much as it's really, really unfortunate you've had this, guess what you've just had done to your body? You only have one strike now. In our group, we only recommend women to go for 3 surgical procedures. So you need to be very, very ultra careful. As of this moment, the fact you've gone for 2 myomectomies, it means the first myomectomy didn't take care of all the fibroids. Probably they took care of the big ones, the moderately big ones. The smaller ones later became big, and they became very troublesome, and we have to go in again. Now, depending on the type of myomectomy you went for, if it's an open surgery myomectomy, now your chances of having your baby is not limited. So this is more reason why you have to have a fertility specialist. This is not a trial and error. This is not asking this doctor today, asking that doctor tomorrow. Go back to the place you had this myomectomy. Let's check and make sure that everything happened okay. Then you begin to consult a fertility specialist immediately. This is what you need to do. Okay, guys, thank you so much. Now, if today is the first day of attending my clinic in YouTube, we normally show up every Tuesdays, 6:30 p.m. Eastern Time US, 11:30 p.m. Nigerian. It's an opportunity for you to learn. Now, if you haven't subscribed, please take out time, subscribe, and also like the videos. When you like the videos, it gives you a better opportunity for YouTube to recommend it to other people. So when you're watching, also like, make comments, share the videos, make sure it goes viral, make sure that anybody that needs this information gets them, because our community is interested in preventing things from happening. And if we together understand our right regarding contraception, then we can have the number of babies we can take care of, then we can plan our pregnancy so that any baby we are having, we are desiring those babies. Okay, so thank you so much for coming this evening. If you're in our Facebook, quickly join me in our Facebook, in our page. I'm going to start this clinic, just a repeat of this clinic, just in few minutes. Thank you so much, COO. Thank you, Tosi. Thank you, Philomena. Thank you, who again? Hassan, and all the people that attended. Share this video. I love you guys. My next clinic in YouTube will be on Saturday. Saturday is 12 p.m. Eastern Time, 5 p.m. Nigerian time. Until I see you then, God bless you and enjoy the rest of your evening. Bye-bye for now.